welcome back. Mama Dr. Jones, OBGYN and mom to 4. Give me just 1 second. What does Miranda Sings have to do with my channel? I'm starting a new series where we review YouTubers' birth stories. This is meant to be in fun. We are just gonna talk about their birth stories of their beautiful babies, go through some of the potential medical sides of that. I thought it was only fitting we start with the Virgin Mary herself, Miranda Sings. If you're not subscribed, please hit subscribe. I put on this lipstick so that we could do this. Like this video at least. This is a video on her channel entitled The Birth, and I'm assuming that this is probably her birth story. Oh my doggy! Freaking break. What the heck? It's not even a birth story. Don't people usually put the whole story up? Not just them screaming and splashing things and baby crying. This is all I had planned for this video. I bought her merch, put lipstick all over my face. Wanted to watch her friggin' birth story. I guess we'll watch some other YouTubers' birth story today. What the heck? What the heck? Stop falling. For some reason, this other one is popping up and recommended, and it's called The Birth of My Son, ! And it's from Colleen Ballinger. I think I'll just go watch that one and make that work for this video. Colleen Ballinger, whoever the heck that is. Miranda, if you see this, just know I try to be like you. I love you. Your birth story just kind of sucks. I know you're a big famous YouTuber and I'm just a little old YouTuber over here with my tiny channel, but thanks for taking my $30 and making me put lipstick on my face and giving me nothing to talk about. Because of that, I'm just gonna go and talk about Ms. Ballinger's baby. I mean, he's cute. He's pretty cute. It looks like they had a baby around the same time. Guess this will work.
Look on the bed, you will see a pile of liquid. That is amniotic fluid, and it gushed out of me and gushed all over the floor on the way to the bathroom. I was feeling horrible last night. I was crying, couldn't sleep. I was just tired and exhausted, and I was like, I just want to have this baby. Well, I guess the Lord heard me because my water just broke.
Only a small percentage of people actually have their water break at home, but it does happen, and it does happen like this, where you can clearly tell that, hey, I woke up in a pool of fluid, it's probably my water. Interestingly, my water did that in my bed with my third pregnancy. It woke me up in the middle of the night. I like felt a big movement and then just a gush of fluid, and I was like, oh no, I don't know if I peed myself, my water broke, who knows. Something I'm glad we had done ahead of time was our babies have kind of been spitty. They spit up a lot after they eat, and so in anticipation of that, we had put a waterproof mattress pad over our mattress to protect it, and we had done that like 2 or 3 days before my water broke. So maybe if you're thinking about it, grab one of those, put it on a few weeks before your due date, just in case your water breaks in your bed, because it was disgusting and I was really happy it was there.
I'm having really small contractions. Called my doctor, he was like, go to the hospital. I haven't packed my bag. We don't have a name for our son. We haven't picked a pediatrician. We are not ready. It's December 10th and our baby wasn't supposed to come till January 1st. We're not ready at all.
Most people don't feel prepared. No amount of preparation preps you for that moment when it's baby time. Nothing. Nobody feels prepared. Very, very common and very normal.
I gotta straighten my hair. I'm in a whole contraction. Oh man, I had a plan. I was gonna go to the doctor on Tuesday and be like, how soon can you induce me? Do you think you could induce me the day before Christmas?
I love that she's doing her hair and stopping to contract in between. I don't know how many of you have watched my birth story, but that's what I looked like driving myself to the hospital. Not recommended. She clearly loves her job and what she does, but she also really, really loves being a mom, and really intertwines that work and being like a strong independent person with also being a very loving mother. So I connect with her on that level. I think she's such a great role model of how you can still be such an excellent mother while working and she works a lot, I'm sure, and she just makes it work. I love that. I love her.
And I am gushing things, not babies, but liquidy things. We're having a baby. Oh my god. We're not ready at all.
He's like freaking out. Oh my gosh, it's happening. I love how happy and excited and like just amped they are to have a baby. Like, I love you.
Don't have underwear, like I didn't pack anything. This is a mess.
What do you need to take to the hospital? I have a whole blog that I wrote about what I took in my hospital bag. I will link it below. At the end of the day, if you're not ready and you don't have a bag packed, just come to the hospital and everything you need to live and function is going to be there.
Sleepy from the painkillers I have that I'm like literally trying to edit. I'm like,
and then you shake your head.
Like,
Best guess, based on what she's saying right now, is that when she got to the hospital, her water was definitely broke, which I think we probably could have gathered from the footage at her house. And she was probably a few centimeters dilated, and they got her admitted in a room. She talks about being a little bit sleepy because she got some pain meds to help with the contraction pain. She's probably talking about an IV medicine, so we can use those in the earlier parts of labor. But when someone gets to be 7-8 centimeters, they're going to be close to having baby. We don't generally want to give them those IV pain medicines anymore because they can linger if it's less than an hour or so from the time you give it until baby's born, and then that can have some effect on baby. It does make you a little bit sleepy sometimes, maybe like feel like you've had a margarita or something, but it wears off really quickly. So that's a good thing as far as you don't always want to be feeling like that when the baby's born, but it's a bad thing because it wears off quickly and labor doesn't.
I can see your peak.
That is not what she wanted to film.
So he just said, I can see your pee. She has a catheter in her bladder. I'm assuming that she's now decided that she wanted to get an epidural because we don't usually put a catheter in somebody's bladder when they're in labor unless they've gotten an epidural. The reason you need a catheter in the bladder when you get an epidural is because you don't have the same functioning of all of your nerves kind of below this area down, and you won't feel the sensation to need to urinate, and your bladder will just keep filling up, and that obviously is not a good thing. Generally, we take that out for pushing, and we also usually just leave it out after the baby's out. For the most part, people can go back to using the bathroom like normal.
And have an epidural. Judge me all you want. I am in way less pain, so I'm really stoked.
I've talked about this a few times. No shame in the epidural. It makes me a little sad that she feels like she needs to say, judge me all you want, because it's true. There's people out there who judge that, and I just feel like if you're doing something that's not hurting yourself or anyone else or society as a whole, then why should we be judging that? Like, we should all just make the decisions that are best for us. She said she's 6 centimeters. Now she's having this shaking. That's really common when you're kind of transitioning into active labor. It's also really common after delivery. So whether you deliver by C-section or vaginal delivery, a lot of shaking after delivery is really, really common. I had that very, very bad with my twins. It just makes you feel like, it's just, I don't know, and the more you fight it, the worse it gets. It does feel really uncomfortable. Luckily, it usually goes away pretty quickly.
How do you feel about your peanut?
I don't like that peanut. They're making me have a peanut in between my legs and I do not like it. It's not a nice peanut. It makes me very uncomfortable. Don't like the peanut. I hate the peanut.
Peanut ball is a great way to help get baby in the right position to come down. Sometimes we use it if a baby is what we call asynclitic, which is where the head is a little bit like off center from how we want it coming into the birth canal. We use it if a baby is OP or occiput posterior. Typically babies come out facing the floor, and occiput posterior is where they are stargazers and they're looking at the ceiling. They have her positioned with this peanut shaped ball between her legs, which helps just kind of orient the pelvis and encourage baby to get in the right position to come down. I think those are excellent, a great tool to use in labor.
She's in a lot of pain, but she's rocking it, man. She's rocking it. 8 centimeters dilated. How big? I don't know how big it is.
8 centimeters is I wish I had a measuring tape up here, but I don't think I have a ruler. I tried to find something that's 8 centimeters. I can't find anything. Google it. Excellent content today, guys. I know that's what you came here to watch, was me telling you absolutely nothing, and you can Google it. That's what you're here for. Excellent content.
Here we are at 8 centimeters and she's doing really good.
I'm gonna be pushing pretty soon.
She's doing great.
Oh, that's so weird. I can feel his head going down to my vagina.
Really?
I literally can. Oh, this is so weird. It's the weirdest thing I've ever done.
Looks like she has a relatively good epidural because she isn't hurting a lot, but she can feel baby moving down and can feel her contractions a little bit. And that's really good for pushing. You don't really want an epidural that takes all the pain away because you want to be able to feel some of what's going on so that you can effectively push when the time comes. I think that's really important when somebody's considering getting an epidural, is to understand that our goal is not to completely absolve you of any pain, although that would be really nice. It doesn't make a lot of sense for pushing, and it can make pushing really difficult. The best epidural, in my opinion, is one where you're not having so much pain that you can't talk about what's going on or discuss the birth with your spouse or significant other, and you're not having so little feeling that you can't move a little bit and feel baby moving down and know where to push and how to push.
Having a contraction.
Yeah, that's like real.
These are all her contractions.
Yeah, so this is real time, and you can see the minutes up here. Obviously, military time -12, so 316 and 320. She had 3.
Now it's going down. Is that how?
So what they're looking at is the fetal heart rate monitoring and the contraction monitoring. The lines on the bottom that they're saying represent her contractions, and then above that you're seeing the baby's heart rate monitor. And what we're looking for in a happy baby monitoring is basically a baby that has a baseline, which is if you just step back and look at the heart rate strip from a distance, you want to see an average heart rate of somewhere between 120 and 160. And then you're also looking at the variability. So you don't want a flat line fetal heart rate tracing. That's scary, not a good thing. So we want some variability, the heart rate kind of going in a jagged line, not a straight line. And then you also want to see some big accelerations where it starts at that baseline, goes up, and then comes back down. That means the baby is tolerating labor well. If there are decelerations or drops in the heartbeat, then you should be investigating why. It's not always terrible, but it does mean you should be paying attention to what's going on and kind of checking it out.
Thumbs up. How you doing?
Cool.
You doing okay?
Baby likes this side.
This is craziness.
Baby likes this side is what I heard from the nurse, and then she also has oxygen on. So my assumption, and again, these are assumptions, I was not there, I don't know them at all, but my assumption is that as she's getting closer to being ready to push the baby out, the baby's had a few little heart rate dips, so they've got her rolled over on a different side in case those heart rate dips were coming from baby laying on the umbilical cord. Sometimes position changes can help with that. And they've got oxygen on her that can also sometimes help with that. And it sounds like from what the nurse is saying that repositioning and oxygen has helped baby to like that better. This is called intrauterine resuscitation, and it's just changing things up in the room, mom's position, what we're doing with baby, medicine doses, things like that. If a baby is having decelerations on the heart rate monitor and we feel like we need to do something different about that.
Contractions.
You could see in that shot some little tiny decelerations in the baby's heart rate, and obviously I'm not there, I don't know what's going on, but just glancing at it from here, it doesn't look like a threatening strip. It just looks like a baby who's probably getting close to delivery. Again, I can't analyze that from here, but it looks like a strip that we probably would look at on the monitor in the hospital and say, yeah, we're probably getting close to delivery. I love this.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
I think we're gonna have a baby puppy in the next push.
Ooh!
Yeah.
Oh my god! There he is!
You can see the baby is covered in white stuff, and that's called vernix, and that's a normal skin covering that near term or a little bit preterm babies have. They're living in a watery environment, and that vernix protects their skin. When they first come out, it also helps to kind of regulate their temperature, moisturize their skin, I guess. It's a skin protecting. That's what it does. He sounds good, he's crying. It took a second for him to go from being a little bit purple to mostly pink, and that's totally normal most of the time. They just came through a tight squeeze, guys. They just need a minute, and most of the time they do exactly like he's done, and they start crying and they pink up and they look great. So he came out screaming, he looks amazing. So far has been a happy and beautiful delivery in my opinion. Okay, stop. How does she still look so dang beautiful? Is this fake? I think this isn't real. I think Miranda Sings would have had a much more realistic birth than this. Nobody looks that beautiful having a baby. I don't believe this.
First meal after the baby's born, of course, has to be in and out.
Last meal is what I ate last night for dinner.
Oh my gosh.
Oh my god, it's so good. I'm so hungry.
You worked hard for that. You deserve every bite of that cheeseburger, my friend. Good for you. They're doing skin to skin. That is excellent. This is great for bonding. This is great for breastfeeding. This is great for your milk coming in. It's so good for temperature regulation for the baby. Skin to skin time after delivery is a wonderful thing to do, and I'm glad to see them choosing to do that here. Please hit that like button. If you're not subscribed, we'd love to have you. We have a lot of fun here. Be kind to yourself, to each other, to me. In the comments, be kind, and I will see you next time. I have a patient in labor that I'm gonna have to go deliver in a minute. I better wipe this off.